Today, I'm excited to be speaking with Dr. Tom Purcell, the Chief Medical Officer of Fred Hutch, about his work to deliver the best and most efficient care possible. Welcome, Dr. Tom Purcell, Chief Medical Officer of Fred Hutch Cancer Center. Thank you for joining us to chat a little bit about what you do at Fred Hutch. So, as Chief Medical Officer, you're obviously the clinical leader of our organization, and you're tasked with overseeing the delivery of quality care and the efficient delivery of that care at a National Cancer Institute designated comprehensive cancer center. So you had told me when we spoke last week, you said when you wake up in the morning, your goal is to try to improve our ability to deliver quality care. So before we really get into the nitty-gritty of what that means and how you're doing that, I wanted to take a little step back to when you worked in Billings, Montana, and I understand that you were a morning radio star. So can you tell us
Yeah.
a little bit about
Well,
that?
yeah, that's probably stretching it a bit, but no, I had the privilege of being the cancer center director at Billings Clinic for almost 10 years and really enjoyed my time in Montana. And part of our growth of that center was outreach. And so did a lot of outreach, but then set up a radio program that I would do on a weekly basis every Monday morning at 6:30 and be on the morning show with the two DJs. And we talked a lot about cancer. We talked a lot about cancer treatments, but we also talked about a lot of other things, fitness and other healthcare, other medical aspects of care. So it was a lot of fun.
Those were the breakfast flakes, is that right?
Breakfast place, that's right. And so that was fun, and it really gave me an opportunity to connect with a lot of people. So it's fun.
Okay. All right. So basically, I just wanted to share that so no one is worried that you don't know what you're doing. Okay. So back to quality of care and improving the care that we deliver to patients. So you had mentioned that we currently our patient satisfaction is ranked as among the top 10 in the country. So I wanted to ask you a little bit about who does that ranking and how we know that and kind of what's next in terms of top 10 seems pretty great.
Yeah, we're very excited about our patient satisfaction and continue to try to improve it, even though we're doing really well. It's a daily thing. All academic medical centers participate in a consortium of a group called Vizient, which tracks a lot of quality metrics, very specific quality metrics, and they're in different categories. But one category is patient centeredness and patient satisfaction. And so, based on a lot of the information that is filled out by patients that goes to different groups, they are able to calculate kind of what the patient satisfaction is based on ratings and such. And so, we're doing very well in that category. We feel as if we typically are in the top 10 to 15 out of 114 programs. So we're very very excited about that. And it's something that, like I said, we really want to continue to improve on.
So that brings me to a next question. I know that there is a lot of effort and a lot of attention and care being paid to how can we at Fred Hutch optimize the clinical care that we deliver? How can we improve our operations to care for more of the people in our community who need our care? So can you tell us a little bit about how we're doing that at Fred Hutch and what patients could expect?
Yeah, we're fortunate to be able to care for so many patients, and the demand for our care is continuing to increase. And so one of the first things that we think about is getting patients into our clinics. And so we call that access. And so really focusing on getting patients in as quickly as possible to see the right physicians. And so that's something where our target is to get patients in within 48 to 72 hours. And so currently we're very aggressive in trying to make sure to have the slots necessary to be able to see all the different types of patients and all the different types of cancers that exist. So it's a center-wide effort that we have ongoing, and we're modifying kind of how we connect with patients, what are the teams that actually connect and talk to patients and make those appointments. And then, of course, working with our physicians and advanced practice providers on making sure that we have the right schedules in place. We call those templates where patients can actually fit in very quickly and be able to be assessed. And then of course, the most important thing is to make the appropriate diagnosis and then get the plan for how we treat the cancer. And so by doing that quickly, we want to get started on the actual treatment as soon as possible.
Okay. And I understand that we're also looking to improve the way that we team up doctors and advanced practice providers to work together at the clinic at the same time. So they're working together on a group of patients instead of being more siloed. So did I convey that accurately? And if I did, what are the advantages of that model of care?
Yeah, absolutely. We're a team model here, and I just literally got off, came from clinic where a patient was telling me this. There's something special about our care because we work as a team, and so that's the physician, the advanced practice providers, nurses, pharmacists, medical assistants, everyone around. There's just a connection to the patient, and what we're trying to do to improve our efficiency is to have closely connected teams where as a physician I partner with very specific people in the advanced practice providers and nurses and pharmacists where we have a cohesive team that continues to deliver that care and patients really appreciate that consistency of care. And then because when I'm working with very closely with my colleagues at advanced practice provider colleagues or other physician colleagues, we're constantly talking about what's the best way to go about this certain treatment or how do we manage these side effects and different types of things. And it really optimizes how we're delivering that care. And so that cohesive team is really what we're working to optimize to allow that kind of care that we want to deliver.
Okay, and that's something that really I think that really distinguishes and sets apart the care that we provide here because you're not just making an appointment with one provider, but that provider loops in a whole team, perhaps other physicians, medical oncologists, radiation oncologists, advanced practice providers, nurses, the pharmacist, everyone's talking together to try and figure out what the best care plan is for every individual patient.
That's exactly right. And, I'm a gastrointestinal medical oncologist, but I partner very closely with radiation oncologists and surgical oncologists and interventional radiologists. And other types of physicians. And we all come together to focus on the delivery of care for that particular patient. And that's called multidisciplinary care. And, and many, if not all types of cancers really benefit from having that team approach to be able to approach the particular patient issues.
Sure, that makes sense. So I could imagine though, as we work more in teams and deliver more comprehensive, a more comprehensive approach to each patient's care, that there might be some bottlenecks with capacity. So how do we plan to work on that so that we can not only serve the patients that we're currently serving, but continue to serve people in the community who need specialized care that can be delivered at a comprehensive cancer center like ours.
Yeah, and we're constantly looking for bottlenecks and different areas to make sure that we have access to radiology, make sure that our pathology reviews are timely, making sure that we have access to inpatient beds, making sure that our surgeons have access to operating rooms, and all of that are critical. That's critical in the kind of the timely delivery of care. And I will add also in that whole team approach is really a research emphasis. We are not only we want the patient to have the optimal treatment, and many times that is a standard of care treatment, but also many times that can be a research trial or something related to research. And so
Mhm.
because we're a research institution, it's part of our mission, we're really motivated to make sure that we're kind of pushing forward the thinking around the treatment of cancers, and we have many different clinical trials that are available for patients.
Okay. And then all of this is being led by the I was about to say transportation, but that's not it. The transformation management office is leading the execution and making sure all the different groups are aligned and on the same page. And is that something are you overseeing that transformation management office?
That's part of our project and moving things forward is kind of having a centralized group that's really following all the different aspects of process improvement that we're going through. So whether it's in access to our clinics and such, whether it's in the care coordination and the care model of care that we are delivering, the capacity aspects of things. All of those aspects are coordinated by the Transformation Management Office. And because we're constantly updating how we deliver care. And so it's important for communication, it's important for education. And so having we call it the TMO, having that Transformation Management Office in place overseeing things is really a key part of how we execute on finishing.
Okay. And then last thing I just wanted to talk about is, some of this represents kind of a cultural shift from the way things have always been done. I think it's just human nature to always say, well, this is the way we do things. And where people may be resistant to change. So I know that I think that might just be your favorite part of your role is bringing people along, creating kind of this unified sense of we're all in this together. But if you could maybe just kind of wrap up by talking a little bit about whether you see it as a cultural shift and why, how you get people to buy in.
Yeah. Well, I think healthcare in general is we really continue to kind of transform kind of how care is delivered, and we know that by connecting with our employees, that's critical because healthcare is about people, and our most valuable asset are people, and of course we take care of patients, and so in talking about kind of our goals and our vision of the ideal state and how we get there, that's constantly what we're talking about in terms of working with our advanced practice providers, our physicians, all the other different employees. It's really important to paint that vision of what we're trying to show. And everyone here really believes that, we deliver the kind of care that we want our family members to receive. And so I really, as we kind of continue to move forward, the change management aspects of, the team is going to be structured this way and not that way. We hope that this is going to be a better way to deliver care. And so that, and I always tell folks, I meet with every provider that starts here. I meet with them, whether they're a physician or an APP, and I tell them our goal is to make sure that that we take care of the very best care of our patients, but also we want this to be the very best job you've ever had. And so in that means that we have structures in place that help people practice at what we call the top of their license, the top of their scope. They're performing at the very best that they can. And so having systems that are in place to enable people to do that is really what we're all.
Okay. Well, that's a great sentiment to wrap up on. Thank you so much for joining
Yeah,
us today.
my privilege.